Welcome to NCLEX Map. Today we explore one of the most essential and life-saving competencies in modern nursing: infection control and proper application of personal protective equipment. Infection control is not just a routine task. It is the frontline defense protecting patients, families, and healthcare workers from preventable harm. Every decision you make, how you wash your hands, how you apply PPE, how you enter and exit a room, can stop an infection or allow it to spread. Excellence in this skill requires precision, vigilance, and unwavering adherence to evidence-based guidelines. We begin with the foundation: hand hygiene. Perform it before touching a patient, before aseptic procedures, after exposure to bodily fluids, after touching a patient, and after touching patient surroundings. Use soap and water when hands are visibly soiled or when caring for patients with spore-forming organisms such as Clostridioides difficile. Alcohol-based rubs may be used in all other situations. Hand hygiene is the single most effective infection prevention strategy. Now we move to isolation precautions, divided into standard, contact, droplet, and airborne. Standard precautions apply to all patients regardless of diagnosis. Gloves for potential exposure, hand hygiene before and after care, and proper disposal of sharps and waste. Contact precautions are used for organisms spread by direct or indirect contact, such as MRSA, VRE, and wound infections. Wear gloves and gown upon room entry, and remove both before exiting. Droplet precautions are used for pathogens spread through respiratory droplets within 3 to 6 feet, such as influenza, meningococcal disease, and pertussis. Wear a surgical mask before entering the room and ensure the patient wears a mask during transport. The highest level of respiratory isolation is airborne precautions required for Mycobacterium tuberculosis, varicella, measles, and disseminated zoster. These patients require placement in a negative pressure room with at least 12 air exchanges per hour. All healthcare workers must wear a fit-tested N95 respirator or powered air purifying respirator. The door must remain closed at all times. Now let us integrate proper PPE sequence. Donning PPE begins with gown, ensuring it covers the torso from neck to knees and wrists to wrist cuffs. Next, place the respirator or mask, securing it snugly over nose, mouth, and chin. For N95 respirators, perform a seal check by inhaling and exhaling gently. Follow with goggles or face shield. Finally, apply gloves over the gown cuffs to create a sealed interface. Once applied, avoid touching your face or adjusting PPE unless absolutely necessary. Doffing PPE requires even more caution because contamination risk is highest during removal. Begin with gloves, grasping one glove at the palm and peeling it away, then sliding fingers under the opposite glove to remove it without touching the outer surface. Next, remove the gown by breaking the ties and pulling it away from the body, rolling it inside out. Perform hand hygiene. Remove goggles or face shield by touching only the strap or headband. Remove the mask last, touching only the ties or ear loops. Perform hand hygiene again. Every motion must be slow, deliberate, and controlled. Let us bring these principles together with a real clinical scenario. You are caring for a patient with suspected active pulmonary tuberculosis. The provider orders airborne isolation. What is your correct action? First, place the patient in a negative pressure room. Perform hand hygiene, then don an N95 respirator, never a surgical mask, ensuring a full seal. Enter the room only after confirming airborne signage is posted and environmental controls are active. Instruct the patient to keep the door closed and wear a surgical mask during transport. Use dedicated equipment to avoid cross-contamination. When leaving the room, remove gloves and gown inside the doorway. Exit, close the door, then remove your N95 only after leaving the isolation area. Perform hand hygiene thoroughly. This sequence ensures no contaminated air escapes and no organisms are transferred to the hallway. Infection control is a constant, active process. Environmental cleanliness, proper waste handling, safe injection practices, respiratory etiquette, and secure equipment management are all essential. Every piece of PPE has a purpose, every step has a reason, and every nurse must apply infection control principles with absolute discipline. When you protect the sterile field, maintain proper PPE technique, and follow isolation guidelines precisely, you protect not only your patient, but every person in the healthcare environment. Welcome to NCLEX MAP. Continue practicing, continue mastering, and continue leading with excellence.